Starting college is exciting. New friends, new classes, a whole new chapter. But let's be real. It can also be a little overwhelming. Feeling stressed about classes, homesick, just need someone to talk to? You're not alone.
At Stockton University, we've got your back. CAPS is here to support your mental and emotional well-being so you can thrive both inside and outside the classroom.
I think the beauty of a counseling center in a college, we have a certain scope of practice. It's general in nature, but each one of my therapists has an area of expertise. So some of our counselors specialize with things like our LGBTQ community or our multicultural center. They'll go down there, they'll work with the OF. We also have a drug and alcohol counselor. And in addition to all of that, we have therapists here who are all trained a little bit differently. So everybody gets the right fit. It's not as though you would only be stuck with one counselor, or if you have a certain issue that's going on, we more than likely will have a group for it or a therapist. And it's included in their student activity fee, so they don't have to pay out any copay or go through insurance.
We offer a range of services to meet your needs. Feeling overwhelmed? Individual counseling provides a safe and confidential space to work through challenges, big or small.
There's many different ways to connect with CAPS. Some students come as a walk-in, and what that means is if a student is struggling with a thing and they really need to be seen today, they can walk into our office and one of us will be seeing them usually within 5, 10, 15 minutes. We always recommend scheduling an appointment, but obviously not everything can be scheduled, and some people are dealing with a thing that they need to talk through, like today. Another thing that could happen is a student schedules an appointment for next Tuesday and they come in. We have an iPad that they fill out some basic information on, and then they sit for a moment or two and then the counselor comes out and sees them. We often take either a shorter history if we're doing a triage, or if it's a full intake, we're meeting with someone for 45, 50 minutes to get a full history of kind of what's going on, what their symptoms are, and then we talk with them about what their goals are for counseling, and we come up with a plan of what that would look like.
What we do best is kind of comeback stories, so often people usually don't come in to tell us how great things are. It's usually, people are struggling with anxiety or depression or, end of a relationship, something difficult, and we help people kind of bounce back, to heal, to get back towards feeling happy and healthy and peaceful again.
The overall philosophy of addictions counseling here at Stockton is from a harm reduction standpoint. So we're really approaching it from first destigmatizing what it means to struggle with substances and what it looks like to get help. And so we work from a prevention standpoint. We reduce the amount someone is using, whether it's with fraternities and sororities or just like a general population, residential life. We really try and come from a non-judgmental place. And then from there, we decide what is the best solution for that person, what's the best way to support. Like I said, we do prevention. We also do intervention. So if someone knows that they're really struggling and they need to get a higher level of care, we can help support that in that moment. And we also do recovery. So we have an entire collegiate recovery community, and we have recovery housing, which is sober housing on campus. And we have a themed living community, which is, we call it Osprey House. So it's people, they might not identify as being in recovery, but they do identify that they want a sober college experience, which for some people isn't the norm, and so they can choose to be in Osprey House, which is a sober community here on campus.
Want to connect with other students who are going through similar experiences? Our group counseling sessions offer a supportive community and a chance to learn valuable coping skills.
Groups can be incredibly helpful, even though some students are a little resistant to groups, because you're matching them with a symptom or a thing that's going on for them with other people that are struggling with the same thing. So then not only do they get support for those symptoms, they also usually end up meeting a vast amount of people that are struggling with the same things. And peer support is often one of the most critical. And then they also gain friendships through many of these groups.
What inspired me to become a drug and alcohol peer educator was definitely the fact that I am a student in active recovery. I wanted to have a community, and not only a community, but something that I could put forth my effort into. There's been a lot of different topics of each month, and some of them are very close and dear to my heart, like alcohol abuse and cannabis abuse. And so being here and getting my voice out is very important.
helping students recognize when they have an issue, and then also helping guide them to getting help and getting the resources they need and things like that, so that way they don't feel so alone.
I feel like peer education contributes to a healthier campus because it's, I feel like drug and alcohol has a stigma to it, and a lot of people, if they're struggling with that sort of addiction, they don't want to come forward. They're very down low about it, and it's hard for them to come forward. So I feel like peer education can help students understand that you can get help and that it's okay to ask for help. We're here for you, and we can offer you resources that can help you in those different types of addictions. So yeah.
Some of our groups that we offer are, we have an anxiety group, we have a women's group, we have some substance use related groups like sober recovery groups. We also have groups that are under the LGBTQ umbrella. We have Transcendence and A-Space. We also have a few groups that are offered in the Multicultural Center. This
is Eva. She is a certified therapy dog from Bright and Beautiful Therapy Dogs. She comes in every Wednesday from 3:30 to 5. We have pet therapy in the campus center. So she's a much better therapist than I am. I've worked with people for 4 years, never saw them smile. And she's talked to them for hung out with them for 5 minutes, and they're laughing and interacting, and their moods are lifted. So it's very humbling. She doesn't have any degrees or anything, but she's really the star, and I'm just kind of an entourage.
Students may benefit from a psychiatric evaluation or medication monitoring as part of their larger mental health treatment. Stockton University provides free psychiatric appointments for currently enrolled students who are also connected with a CAPS counselor. Even if you have a private therapist, CAPS counselors may also be able to help you get connected with a psychiatrist.
The psychological piece is we also have psychiatrists on staff that are they're technically Atlantic Care psychiatrists that we have here twice a week. So our students have access to psychiatric services as well if they're struggling with anxiety or depression. Or some other symptoms that sometimes require medication in addition to counseling services.
For convenient on-demand support, check out You Will. It's an online platform that provides free, immediate access to teletherapy with resources and tools you can access anytime, anywhere.
The idea that we have people here every day, and we also have You Will this year, which is a telehealth that's free to them as well. So after hours, when we're not here, or if they need a crisis phone number, that they can contact that. But the benefit is that in this society, everybody needs somebody to talk to, and it's built right in. Everybody's professors will talk to them about the fact that CAPS exists here. We go to the orientations and let everybody know that it's a very normal thing to do when you're transitioning to something like college.
Whether you're navigating academic pressure, relationship issues, or just need a little extra support, CAPS is here for you.
We're all struggling in some way. Every human being, even counselors have their struggles, and sometimes we just need a safe place to talk about it that's not our mom and it's not our friend, and it's kind of this unbiased human that's going to not only assist us in navigating it, but also reminding us that it could be okay and it's not abnormal to struggle with these different things.
We're committed to helping you build resilience, manage stress, and make the most of your Stockton experience.
We all need help. There's no shame in asking for help. And coming into the counseling center doesn't mean that you're going to be in a lifetime of counseling forever. We're a short-term model here, but I think it's a really nice first step to be able to ask for that help, get it from a qualified person, and then be able to decide if it's for you or not.
Ready to learn more? Visit the CAPS website, call us, or stop in and visit us in person at our offices in J204.